the goal was really to amplify what the patient voice, as well as to better understand the role and perception of advanced practice providers in the myeloma space. Although it is a relatively rare blood cancer, there are a lot of options in terms of treatment, which is part of what makes treating people with myeloma complicated. So it represents about a little less than 2% of the hematologic malignancies, but people can live for a really long time, and there's a lot of questions around sequencing treatment and taking into account what's important for patients in terms of their quality of life or their goals for their own survival, and really to reflect what's important to them, their values. I think the first one was really to put a pin in the map on how familiar patients are with APPs, as well as how familiar they are with myeloma, and then kind of turning the lens around, how equipped do APPs feel in terms of education and resources to take care of patients with myeloma. So anything that would deepen the knowledge around that, many APPs felt like they could have benefited from more education or been part of the patient's journey a little longer, starting from the beginning throughout. And for patients, they really felt like they could have been equipped with a little more educational resources. They were unclear on where to turn in terms of trusted education on myeloma. So I think some of those would be to provide resources like the Make It Happen Multiple Myeloma, which is a website, to kind of provide some of those and then look at the impact of that, as well as to try to diversify. The total survey sample was about 200 APPs and 100 patients. So I think to expand that number would also be really nice to have some more generalizability for the results. The Association or for Advanced Practitioners Society in Hematology and Oncology partnered, which I'm actually a member of, I'm on the board, partnered with Janssen to really recognize the space that advanced practice providers occupy in myeloma. And so that they came to ASPHO and with this intent, and then partnered to create this survey. And the way that they went about it was to look for APPs, which include nurse practitioners, happy NP week, physician assistants or associates, and pharmacists. They make up APP, and ASPHO has about 5,000 members who are part of our organization, and many of them provide care to multiple myeloma patients. And so the survey was really to get at you had to be licensed to practice, you had to take care of at least 3 people with multiple myeloma in a year, and you were included in this survey. There were, as I mentioned, 200 respondents. And for patients, you just had to have multiple myeloma and be over 18 to respond. So it was a pretty nice cross-section in terms of nurse practitioners and physician assistants. But I think amplifying any research that amplifies the patient voice and asks questions like, who do you feel most comfortable asking questions to, who, where would you go for resources on multiple myeloma and sequencing treatments? Those are really important questions to ask in order to deliver patient-centered care. About 70% of the APPs responded that they didn't feel like they had enough time to properly educate patients on their condition or on their treatment options, as well as obtaining insurance approval for treatments, and keeping everybody informed. The caregiver is also a really big part of anybody who's received a diagnosis of multiple myeloma. There can be a lot of side effects from both the disease as well as the treatment. So engaging caregivers and informing them in the discussion, I think, was also a challenge for APPs.